Part A. Extract 1. Questions 1 to 12. You hear a gynecologist talking to a patient called Mihiraa. You now have 30 seconds to look at the notes.
Good morning, Mihiraa. How can I help you today?
Good morning, doctor. I'm here because I haven't felt the baby move in the last 12 hours. I'm really worried.
I understand you're concerned, Mihiraa. Let's discuss this. How far along are you in your pregnancy?
I'm 32 weeks pregnant.
When did you last feel the baby move?
I think it was yesterday morning. I had a regular pattern of feeling the baby kick and turn, but it just stopped suddenly. I haven't felt anything since.
Okay, have you experienced any other symptoms like vaginal bleeding, abdominal pain, or contractions?
No, there's no bleeding or pain. But I've been feeling a bit tired lately.
Have you noticed any changes in your daily routine or stress levels that might have triggered this?
I've been working long hours, but I've been trying to rest as much as possible. I don't think anything specific has changed.
Let's check your blood pressure. It's important to rule out any potential issues.
Okay.
Your blood pressure is within normal range. You seem to be okay.
It means. What about the baby?
Mihiraa, let's do a quick check. I'll listen to the fetal heart rate and it also seems okay. This is a good sign. However, we need to monitor the situation closely.
I'm so relieved to hear that. But I'm still worried about the baby not moving.
It's understandable to feel anxious. We'll do a non-stress test to assess the baby's well-being. This involves monitoring your baby's heart rate in response to the baby's movements.
Okay, doctor. I hope everything is all right.
We'll also do a biophysical profile.
Well, what does that mean?
Mihiraa, this includes assessing the baby's breathing movements, muscle tone, and amniotic fluid volume.
What if the results are not good?
In that case, we might need to consider hospital admission for further monitoring and potential interventions like fetal echocardiogram or umbilical artery Doppler.
Oh no, I don't want to think about that.
It's important to be prepared, Mihiraa. We'll do everything we can to ensure the baby's safety. I suggest we arrange a counseling session to discuss your concerns and options in more detail.
Will that work, doctor? I don't think that would be helpful.
We want to be able to intervene quickly if needed. We'll also arrange a session with a maternal-fetal medicine specialist to make you prepare.
Thank you for your time, doctor.
Extract 2. Questions 13 to 24. You hear a nurse talking to a patient called Mihiraa. You now have 30 seconds to look at the notes.
Good morning, Mihiraa. Please have a seat. How can I help you today?
Good morning, nurse. I'm here because of this irritation on my arm. It's been bothering me for a few weeks now.
Okay, Mihiraa. Can you tell me a bit more about it? When did you first notice it?
It started as a sunburn, I think. I went to the beach and got a really bad burn on my arm. It was red and painful, but I thought it would heal on its own.
When was it?
About a month ago.
I see. And what happened after that?
Well, the redness went away after a few days, but then a small, dark spot appeared. It's been growing slowly, and it itches sometimes. I've been using hydrocortisone cream on it, but it doesn't seem to help.
Okay, Mihiraa. I'm going to take a closer look at that. Let me just get some gloves on.
Sure.
This looks a bit concerning, Mihiraa. I think we need to do a biopsy to determine what's going on.
What's that, nurse?
It's a procedure where we take a small sample of the skin for examination under a microscope. It's a quick and relatively painless procedure.
Okay, I guess that's necessary.
I'm going to refer you to a dermatologist. They can perform it and discuss the results with you.
What do you suspect, nurse? I feel anxious.
Well, Mihiraa, it's possible that this could be a type of skin cancer.
What? Oh no.
It's okay, Mihiraa. We don't know for sure yet. But it's important to get it checked out. Even if it is so, the earlier we catch it, the better the chances of successful treatment.
What kind of treatment?
Well, that will depend on the type of cancer you have got. If it's caught early, it might be treated with a simple procedure called excision.
Means?
Yes, that's where we remove the cancerous tissue and a small margin of healthy skin around it.
And if it's not cancer?
If it's not cancer, we can discuss other treatment options, such as topical creams or other medications.
Okay, thank you, nurse. I'm a bit scared, but I'll do whatever you say.
It's understandable to feel scared, Mihiraa. We'll get through this together. I'll schedule an appointment with the dermatologist for you.
That is the end of Part A. Now look at Part B. Part B. In this part of the test, you'll hear 6 different extracts. You'll have time to read each question before you listen. Now look at question 25. You hear a pharmacist talking to a patient called Mihiraa. Now read the question.
Mihiraa, it's crucial to shake your inhaler vigorously before each use. This ensures that the medication inside is evenly distributed. Hold the inhaler upright and inhale slowly and deeply as you press the top. Once the medication is inhaled, hold your breath for about 10 seconds to allow it to reach deep into your lungs. If you require another puff, wait at least a minute before repeating the process. Regular cleaning of the mouthpiece is essential to maintain optimal inhaler function.
So, to summarize, I should shake the inhaler well to mix the medicine, inhale slowly while pressing, hold my breath, and wait a bit before using it again. Got it?
Exactly. Shaking is vital to ensure you receive a consistent dose with each inhalation. If you find yourself needing frequent refills or experiencing difficulty breathing, it might be time to consider using a spacer. This device can help improve medication delivery. Also, if you notice rapid breathing after using your inhaler, it's essential to inform your doctor.
Now look at question 26. You hear a physician talking to a patient called Mihiraa. Now read the question.
Mihiraa, you've sprained your ankle. We need to reduce swelling first. Elevate your foot above your heart as much as possible. Ice it for 20 minutes every hour. Avoid putting weight on it for a few days. Compression bandages can help, but ensure they're not too tight. Over-the-counter pain relievers like ibuprofen can assist with discomfort.
So, I should keep my foot up, ice it often, not walk on it, use a tight bandage, and take those pain pills?
Exactly. But remember, the bandage shouldn't cut off circulation. If your foot turns blue or feels numb, loosen it. Also, if the swelling increases, pain worsens, or you can't bear any weight after a week, return for a checkup.
Now look at question 27. You hear a nursing manager talking in a morning meeting. Now read the question.
Good morning, team. I'm excited to announce the implementation of a new pre-procedure checklist. This is a critical step towards enhancing patient safety and standardizing our practices. The checklist covers everything from patient identification and consent to equipment readiness and emergency protocols. It's essential that every member of the team adheres to this checklist rigorously. We've incorporated input from all departments to ensure it's comprehensive and practical. Remember, this isn't just a piece of paper. It's a safeguard for our patients. It's designed to reduce the risk of errors, improve communication, and ultimately, enhance patient outcomes. I understand there might be an adjustment period, but I trust your professionalism to embrace this change. Let's make this checklist a cornerstone of our patient care. Any questions?
Now look at question 28. You hear two nurses talking in a ward. Now read the question.
Mihiraa, have you seen the chart in room 321? The patient, Mr. Porter, is post-op from a hip replacement. His vitals are stable, but he's been complaining of pain in his calf. I've already elevated the leg and applied a warm compress, but the swelling seems to be increasing. I'm worried about a potential DVT.
Deep vein thrombosis? Calf pain, swelling, and redness are classic signs. We need to notify the doctor immediately. Let's check for any other symptoms like shortness of breath or chest pain. Also, we should continue to elevate the leg and apply compression stockings.
Good thinking, Mihiraa. I've already started documenting everything. We should also prepare for a possible Doppler ultrasound to confirm the DVT. In the meantime, let's keep a close eye on his oxygen saturation levels and heart rate.
Absolutely. I'll update the patient's family about the situation and let them know what to expect. We need to be prepared for potential interventions like anticoagulant therapy.
Now look at question 29. You hear a doctor talking to a junior nurse. Now read the question.
Mihiraa, we're using dissolvable stitches on Mrs. Lee's abdominal incision. They're made of a special material that the body absorbs over time. This means no need for removal, which is less painful for the patient. However, they don't provide as much strength as traditional stitches initially. So we need extra protection with the glue. It's crucial to monitor the wound closely for signs of infection, like redness, swelling, or increased pain. Also, avoid strenuous activities until the stitches have fully dissolved.
So, dissolvable stitches are like magic, they just disappear? But they're not as strong. That's why we've reinforced them with surgical glue. Got it? I'll keep an eye on the wound and let you know if anything changes.
Exactly. They're a great option for certain types of wounds, but understanding their limitations is key. Remember, patient education is essential. Make sure Mrs. Lee knows about the dissolvable stitches and what to expect.
Now look at question 30. You hear a dentist talking to a patient. Now read the question.
Mihiraa, flossing is as important as brushing. It removes plaque and food particles from between your teeth that your brush can't reach. This helps prevent cavities and gum disease. You should floss at least once a day, preferably before brushing. Use about 18 inches of floss, wrap it around your middle fingers, and gently slide it between your teeth. Go up and down the sides of each tooth. So, flossing gets the stuff my toothbrush misses? That makes sense. But won't it hurt my gums if I do it wrong? It might if you're too rough. Be gentle at first. If your gums bleed, don't stop flossing, but be more careful. Regular flossing will actually help your gums become healthier over time. It's like exercising for your mouth.
That is the end of Part B. Now look at Part C. Part C. Extract 1. Questions 31 to 36. You hear a nurse talking about 35 years of ward experience at the Mihiraa Research Center. You now have 90 seconds to read questions 31 to 36.
Good morning, esteemed colleagues, researchers, and fellow healthcare pioneers. It's an honor to stand before you today, not just as a nurse, but as a seasoned mariner who's navigated the complex seas of patient care for 3.5 decades. Mihiraa Research Center, a name synonymous with hope and innovation, has been my second home. It's a place where the ordinary transforms into extraordinary, where challenges are not roadblocks, but stepping stones to breakthroughs. Each corridor, each room, echoes with stories of resilience, of life and death, of triumphs and trials. And I, a humble nurse, have been privileged to be a part of this epic narrative. The ward is a microcosm of life. It's where the fragility of existence is laid bare. But amidst the routine, there's an undercurrent, a silent tremor that can paralyze even the most seasoned professional. It's not the unexpected surge, not the sudden crash, but the gradual, insidious decline. Watching life ebb away, inch by inch, day by day, is a battle against time, a silent war where hope is the only weapon. It's a battle fought not just by the patient, but by those who hold their hands. Nursing is a profession of paradoxes. We cradle life and confront death. We soothe pain and endure exhaustion. The emotional toll is immense. It's like being the calm center of a tempest, where the eye of the storm is your heart. Meditation, for me, has been an anchor. It's not about escaping reality, but about creating a space within where you can observe the storm without being consumed by it. And then, there's the power of human connection. Sharing experiences, laughter, and tears with colleagues creates a support network that's invaluable. Nurses, in their dedication, often prioritize patient care above their own well-being. It's a noble sacrifice, but it's a double-edged sword. Self-care isn't selfish, it's a responsibility. It's like refueling a car. Without fuel, it's just a metal shell. Sleep, nutrition, exercise, they aren't luxuries, they're necessities. And let's not forget the power of hobbies. They offer a much-needed escape, a chance to recharge. Each patient is a unique chapter in the complex narrative of life. Some stories, however, leave an indelible mark. One such patient was a young boy, residing at the Mihiraa Research Center, diagnosed with a rare genetic condition. His indomitable spirit shone through even as his physical health declined. Our role transcended that of mere nurses. We became his steadfast companions. His courage inspired us deeply. His eventual passing was a profound loss, yet it filled us with a profound sense of purpose for having walked alongside him throughout his journey. Nursing is often misunderstood. It's not just about administering medication or changing bedpans. It's about empathy, compassion, and an unwavering belief in the inherent dignity of every human life. It's about holding hands, wiping tears, and offering hope when it seems lost. It's about being a rock in a stormy sea. It's about being present, fully, in every moment. Achievements are often quantified. But in nursing, success is often intangible. It's the smile on a patient's face, the gratitude in a family's eyes, the knowledge that you've made a difference. It's the countless lives touched, the countless hearts healed. And for me, the greatest achievement is not a promotion or an award, but the privilege of walking this path for 35 years, of being a part of this incredible journey. Revised paragraph. Mihiraa Research Center is more than a workplace. It's a crucible of human spirit. Here, amidst hope and innovation, I've witnessed life's fragility and strength intertwined. As a nurse, I've been privileged to be part of these transformative journeys, filled with both triumphs and heartbreaks. Each patient story is a chapter in this grand narrative of life, and I'm grateful to contribute to it. The challenges are immense, the hours demanding, but the rewards are immeasurable. It's a profession that requires unwavering compassion, technical expertise, and an unyielding spirit.
Now look at Extract 2. Questions 37 to 42. You hear a gynecologist called Mihiraa being interviewed about the latest gynecological advancement. You now have 90 seconds to read questions 37 to 42.
Dr. Mihiraa, it's a pleasure to have you here today. Your work in the field of gynecology is groundbreaking. Let's start with the latest advancement. What can you tell us about it?
Thank you. The latest frontier in gynecology is the intricate dance between genetics and reproductive health. We're delving deep into the genome to understand, predict, and potentially prevent a myriad of reproductive issues. It's a complex interplay of nature and nurture, where we're unraveling the genetic blueprints that influence everything from fertility to menopause.
That sounds fascinating. Could you elaborate on the importance of this advancement?
Absolutely. This genetic exploration is akin to possessing a roadmap to an uncharted territory. By identifying genetic predispositions, we can tailor preventive measures, early interventions, and personalized treatments. It's about shifting from a reactive to a proactive approach to women's health. Imagine being able to predict the onset of menopause or the risk of ovarian cancer based on genetic markers. It's a paradigm shift in how we perceive and manage reproductive health.
Why is this genetic screening and counseling advised, Dr. Mihiraa?
It's not a one-size-fits-all recommendation. Genetic counseling is a nuanced process that involves understanding individual and family medical histories. It's about empowering women with knowledge. For instance, if a woman has a family history of breast cancer, genetic testing can reveal if she carries specific gene mutations that increase her risk. Armed with this information, she can make informed decisions about screening, preventive measures, or even prophylactic surgeries.
There are always opposing views on new medical advancements. Dr. Mihiraa, how do you address concerns from social groups against genetic testing in gynecology?
It's essential to engage in open and honest dialogue. Fear often stems from misinformation. For instance, some might worry about genetic discrimination. To address this, we emphasize the importance of privacy laws and ethical guidelines. We also highlight the potential benefits, such as early detection and prevention. It's about building trust and dispelling myths. For example, a woman who discovers she has a higher risk of ovarian cancer might opt for increased surveillance, potentially catching the disease at an early, more treatable stage.
Given the complexity of this field, Dr. Mihiraa, why should young women consider specializing in genetic gynecology?
It's a field at the cusp of revolutionizing women's health. For those passionate about making a significant impact, genetic gynecology offers unparalleled opportunities. It's a blend of medical science, genetics, and counseling. Imagine being able to unravel the mysteries of infertility, endometriosis, or polycystic ovary syndrome at a genetic level. It's about being at the forefront of medical innovation.
That sounds inspirational. While this is a promising advancement, Dr. Mihiraa, are there any alternative approaches to addressing reproductive health issues without relying solely on genetics?
Genetics is a powerful tool, but it's not a panacea. Lifestyle factors, environmental influences, and overall health contribute significantly to reproductive well-being. A holistic approach is crucial. Nutrition, exercise, stress management, and regular checkups remain fundamental. Genetics can complement these efforts by providing a more targeted approach. It's about combining the best of both worlds.